Welcome to Johns Hopkins Bayview Medical Center, Department of Rehabilitation Services, a place where dedicated therapists exercise their knowledge, skill, and compassion to the benefit of their patients.
There's honestly nothing more self-fulfilling and better for your self-esteem than to know that you came in and you made a difference in one person's life who made a difference in someone else's through your therapy.
There are no boundaries here. We all work together, which is what I love about the teamwork.
Just the team here really works hard to strive to get the best for the patient.
I feel that the more I help people, just the better it makes me feel.
When your ultimate goal is to help people to get out of the hospital and get back home and get back to doing the things that they do in their life, you really need everybody working together and coming together to make that happen. And that's the most important thing that we do, is help people, live healthier lives.
Even though we're treating patients, we try to make it fun and just laugh and joke and have a good time. It's really a loose atmosphere.
The people here are amazing. Everyone is so friendly and so helpful that I did make a great decision in moving down here and working for Johns Hopkins.
A full spectrum of therapy services are provided by the Johns Hopkins Bayview Rehabilitation Team of over 100 therapists. Our patients range from a gestational age of 23.5 weeks to 103 years.
The thing I actually like most is working with my other colleagues and the other professions, the other disciplines. I think, especially at Bayview, it's very transdisciplinary where we all work together as a team.
Maybe you want to work with a different patient population. Maybe you want to focus on neuro. Maybe you're finding your niche and you're learning more about yourself. The team here will help you to do that, and they'll help you to find the right place for you and the right fit for you, whether that be outpatients or inpatients or the main hospital or working in one of the special programs on campus. You'll find that, and people will help you grow here as a person and find the right fit for you.
We are recognized locally, regionally, and nationally for many of our outstanding rehabilitation programs. Burns, complex strokes, geriatrics, orthopedics, and pelvic floor disorders are but to mention a few.
One of the great things about the Hopkins Bayview is that there are so many areas that you can work in, and so many areas, especially of OT, that you can work in.
The Hopkins institution is a great place for learning, especially for newly grad. There's a lot of mentors, I would say, in this hospital that can help you grow professionally. And being exposed to different settings, I find it very stimulating.
I think that what I can tell you is that you have so much opportunity here. You can literally, if you don't know what area of occupational therapy, physical therapy, speech therapy you want to work in, you have that opportunity to start somewhere, and then
you can be working in a burn intensive care unit, a neonatal intensive care unit, or you can be, treating hip replacements or knee replacements. So
here you see so many different diagnoses. The staff is very supportive. If you'd like to do NDT training, if you'd like to be better with treating people with strokes or people with orthotic issues or people who have cardiac issues, there's so much variety and so many different venues for you to learn more about those different diagnoses that it really makes it a very eclectic place to work.
People support each other personally, at work, anytime you need somebody, there's always someone around to help you.
The 130-acre Bayview campus is a welcoming environment for our patients and staff in a variety of clinical settings. Facilities include expansive, well-equipped clinics, specialized treatment areas, and observation and quiet rooms.
It's very important for us to have the space that we need, especially when you're doing some gait training, transfer training, and functional activity training for patients. You need those space and equipment, and Bayview has provided those things for me.
Having an open area gives you the room to support the patients as you need to, guard the patients as you need to, but also having other things around, you can create obstacles and create the kind of effect you want when treating your patient.
It's bright, it's very patient-friendly, it's very therapist-friendly, it's an inviting atmosphere. It doesn't feel like your stereotypical what you would think of being in a hospital.
It is. It's a positive thing to have a really nice environment to work in. It keeps your spirits up, it keeps your patient's spirits up. They're like happy to come down to the rehab gym because it looks nice.
Working in a modern department like we do, it certainly makes the patients a little bit more comfortable because everything is new and clean. We have all the equipment that you could possibly need to do your job.
And looking outside and seeing the sunlight, it just brings a smile to your face just to see the outside light and get that.
The patients love this area, especially they call it as the rose garden, because during springtime and summertime you see lots of flowers out there, and the bright open, the light just comes in here, and the bigger area, they love the trees around there, so it's a plus for a patient.
Johns Hopkins Bayview's Rehabilitation Services Department is committed to providing an outstanding practice environment that utilizes the most up-to-date technology.
There are a lot of advances in technology that are definitely coming. The advance of computer documentation using computerized charting, which we do have here at Bayview.
Okay, we have a computerized documentation system here, which I really like because everything is on the computer. You go to the computer to find your note.
If you want to retrieve your patient's data from the past few weeks, you can just type in the name of the patient, and it's readily available for you rather than going to the medical records and just asking for them.
Well, I've really seen the department grow in lots of areas on campus with equipment and with resources that the therapists really want and are really asking for. And administration responds right away.
And I feel like Bayview is keeping up with the advances in technology today.
Bayview provides our physical therapists, occupational therapists, and speech and language pathologists the opportunity to pursue their passion and professional goals.
One of the things I enjoy most about being here is having the opportunity to use my bilingualism to converse with patients and to assist them. So I'm able to converse with them in Spanish and use it pretty much on a daily basis.
So as an occupational therapist, just being able to work in a lot of places on campus, a variety of settings with a variety of people, and then also being a coordinator here in the main hospital has been just a great experience.
See patients in acute, and then in the next hour I'll go to outpatient, and then maybe go outside and go to a home visit, and you get to see different areas in the day, and no other place can give you those opportunities, I would say.
I enjoy working at Bayview in the outpatient department because I get to see a variety of different cases and diagnosis that I wouldn't see at another setting.
When I think about burns and I think about how you treat them, you treat that entire person. You've really got to combine everything you've learned in physical disabilities and psychological disabilities and put it together.
I enjoy coming to work every morning. I welcome the challenges that the day is going to bring. I enjoy my patients. I like to work with them. I like to problem solve and figure out ways to help them better. I mean, that is why I became a physical therapist, and Bayview has allowed me to do what I've been wanting to do.
The Johns Hopkins Bayview Medical Center campus is home to acute hospital therapy services, a comprehensive inpatient rehabilitation unit, outpatient services, geriatric and young adult specialty rehabilitation programs, and the Johns Hopkins Burn Center.
Fortunately, I was able to work somewhere else prior to working here and not coming to here thinking that every job would be like this one. This is definitely a utopia, and it's a lot different than the experiences that other people as therapists have.
We love the benefits, the medical insurance, tuition assistance.
Just my benefits have been wonderful, tremendous. Everything's been covered for me 100%. My medical supplies, my medical care has been covered 100%. My pregnancy was a high-risk pregnancy, and everything was covered 100%.
Johns Hopkins provides financial incentive as well as time incentive for you to continue your education. You're able to take time off from work to attend a class that maybe occurred during your regularly scheduled work day, which is a big benefit.
We have full medical benefits. We have 403B plan. We have tuition reimbursement with paid time off. We also have a dependent tuition reimbursement plan.
The faculty is very encouraging for taking continuing education courses. They do give you money to help support you in doing that. The tuition reimbursement, I'm already scheduling to take a Spanish course in the future, so that's something I want to pursue.
Just knowing, I think just knowing that I could take continuing ed classes, and I've taken classes every year. I think I've had the opportunity here more than other places to keep up with continuing ed and to take the classes that I really want to take. Bayview offers a daycare on campus, so I know that my little one's going to be able to come to work with mommy and be here, and I know that she's here and she's safe and that she's in a great place.
They really take good care of my kids. They have nice educational program there, teach my kids how to read the alphabets, count numbers. So when I pick them up in the afternoon, they'll just say, "Hey Dad, I know how to count 1 to 10 or say ABC." So it's, at the end of the day, it's really something.
The flexibility of that, just not having to drive her somewhere else. She's coming to work with mommy, and she's leaving work with me as well. So I love that. I think Bayview is just an amazing facility. I think, compared to other facilities where I've worked, I just feel like they don't have it all together. There's a lot of pieces and parts missing, where Bayview, there's a really strong rehab team. There's just really a cohesiveness among the rehab team, and even throughout the hospital.
We're like, a family here.
People are also really nice here. There isn't an air here at this hospital. People are very acceptable, very open.
I just knew that this was the population that I wanted to work with, and I just knew that I wanted to surround myself with the professionals here at Johns Hopkins Bayview.
I like it here because the therapist and the supervising staff, they're willing to nurture you as much as you need for guidance, but then they leave you alone enough to explore things that you want to explore.
There's such a heart here. There's a heart for people. There's a heart for one another. I think not only do people here take care of the patients, but I think they help take care of each other, and it makes for a really happy work environment.
I can see bigger and better things coming, and I think that Bayview can do that for me.
Johns Hopkins Bayview Medical Center, Department of Rehabilitation Services, providing opportunities, setting standards.